So have you ever wondered what happens to your body when you go into space? Well, that is the really exciting question that NASA are trying to answer through their Human Research Programme. Let's take a little look at what they've discovered so far and how your anatomy is affected. One of the first really important parts that are affected are bones. So NASA has learned that without gravity working on your body, your bones lose minerals. These are some of the building blocks that make your bones strong. So when we lose minerals from our bones, the bones will get weaker. This weakness in bone is called osteoporosis. This picture shows a normal bone alongside an osteoporotic bone. So you can see how much weaker the inside of this bone looks compared to this one. On Earth, we lose some of our bone mass at around 1% to 1.5% per year in elderly men and women. But in space, NASA have found out that this can be over 1% loss per month. The weaker a bone is, the more likely it is to fracture. One of the most common places for fracture is in the femur, the bone of the thigh, as you can see here and here. NASA also talks about the fact that if you don't exercise and eat properly, both of which can be really hard to do in space, you will lose muscle strength and endurance, so the ability to keep on going. Muscles need to be used regularly to maintain their size and strength. If they're not used properly, then they will start to get a bit smaller, and this process is called atrophy. An example of it can be seen here. So this patient has a much smaller leg on one side than on the other side. A similar thing happens if you break your leg and have it put into a cast. The leg in the cast which you're not using will look smaller than your other leg when the cast is removed. Usually when muscles start to atrophy or get smaller, they will also get weaker over time, making it much harder to do the required exercises in the first place. So if astronauts are to stay nice and strong and healthy with strong muscles, they need to make sure that they can exercise properly. So your heart is also a muscle, and just like the muscles we've seen on the last slide, it needs to work regularly and work hard to maintain its strength. And so what NASA have found is that because it doesn't take a lot of effort to float around in space, you're not spending a lot of physical energy to do that, the heart muscle doesn't need to pump so hard, it doesn't need to beat so hard, and it's not being used as much. And therefore an effect known as cardiovascular deconditioning can occur. Put really simply, this means that your heart does not and cannot pump blood around your body as effectively as it does if you are a healthy individual here on Earth. This can lead to a number of problems, including a possible increase in the risk of fainting. It can lead to an increase in your heart rate at rest and a decrease in your physical ability, which basically means you won't be able to do as much. A final area that NASA have looked at in a bit of detail are your eyes. So NASA have noticed that within moments of astronauts becoming weightless in zero gravity, their head and neck swells up quite a bit, so the swelling is quite noticeable. At the same time, their waistlines and legs become slimmer. And it's thought that this is caused by a shift in the fluid that is inside the body. And what they think is the fluid is shifting from the lower areas to the higher areas, so it's shifting up towards the head and neck regions. So usually when you're on Earth, people are in a position that keeps most of the fluid of the body in the lower areas of the body. But this is not the case in space, and fluid shifts up towards the head. This increase in fluid in the head area can put pressure on the eyes and the nerves which carry vision signals from the eyes, and that results in changes to vision. Many astronauts have reported that their vision is impaired or changed both during and after space flights, in some cases for many years after space flights. NASA are working hard on ways to help or prevent all of these changes from occurring. For more information, you can see the Human Research Programme, part of NASA, at the link below, and for more information on what we at the Centre for Anatomy and Human Identification at the University of Dundee do, please see our link below as well. Thank you.